Assalamu alaikum. Today we will discuss about clinical feature of multiple sclerosis. Clinical feature 1 is optic neuritis, then optic atrophy, then intranuclear ophthalmoplegia, then afferent pupillary reflex. This is from eye. Then syndrome. One syndrome is partial brown sequard syndrome. Then B, brainstem syndrome. Then C syndrome is cerebellar syndrome. This all about syndrome. I, optic neuritis, optic atrophy, intranuclear ophthalmoplegia, afferent pupillary reflex. All about eye. Then syndrome. Then come to the T. One T is tremor. One T is trigeminal neuralgia. One T is transverse myelitis. Then some haphazard symptoms. One is ataxia. 2 is paraparesis. Paraparesis, which is progressive paraparesis. Ataxia, progressive paraparesis, and then LHER, Lehermitt, MITT, Lehermitt symptoms. I, from I, this, then syndrome, then T and others, ataxia, paraparesis, Lehermitt syndrome. From T, tremor, trigeminal neuralgia, transverse myelitis. Syndrome, brown sequard syndrome, brainstem syndrome, cerebellar syndrome. From C, we can also remember cognitive behavior, cognitive dysfunction, cerebral symptoms, brainstem syndrome, brown sequard syndrome, afferent pupillary reflex, intranuclear ophthalmoplegia, optic atrophy, optic neuritis. This is all about clinical feature of multiple sclerosis. Optic syndrome, T and other. Optic neuritis, optic atrophy, intranuclear ophthalmoplegia, afferent pupillary reflex. 3 syndrome, brown sequard syndrome, brainstem syndrome, cerebellar syndrome. We can also remember from this C, cognitive dysfunction, and other from ataxia, progressive paraparesis, and Lehermitt symptoms. Assalamu alaikum.